well as all those who've been involved in Gold Command and who have been able to bring together the work of the county councils, the district council, and of course all of the critical workers who have kept the county going over these last 3 months. It is remarkable how well prepared they were and how able they were to cope with the peak without ever running anywhere near being overwhelmed in the system. It also, Madam Deputy Speaker, allows me to put on record my condolences to the family of Julie Omar, a very well-regarded nurse who lived in Malvern, very sadly passed away in April at home with symptoms of COVID-19, and from the outpouring from the community and from those she worked with at Redditch Hospital, it was clear that she was an absolutely remarkable woman. I did not know her personally myself, but clearly no words will ever be able to make up for the loss of such a remarkable individual. But I hope that by paying tribute to her work here in Parliament, that it will help her family to come to terms with their loss. I want to speak this afternoon about innovation, and really innovation in 3 key areas: innovation in organisation, innovation in treatment, and innovation in testing. And clearly there has been massive innovation in all 3 areas throughout this crisis. On the organisational side, it's been amazing to see not only the new Nightingale hospitals being built, but also so many GPs, I think almost all of them now, able to deliver telemedicine. The innovation that's allowed us to ramp up the ability to deal with such high volumes. And of course the appointment of Lord Dayton, who's been able to make such a remarkable difference through innovation in terms of the PPE supply chain, and really exceptional how that has been dealt with. And I would like to request that perhaps we put someone of that calibre in charge of planning how we're going to ramp up and innovate organisationally to deal with the backlog of the more routine treatments that are needed for so many of my constituents now. Secondly, in terms of innovation in treatment, I'm very proud that it's been UK scientists who've discovered the important role that dexamethasone can play in treatment, because it is such a cheap treatment, and I think will be a help all around the world where the infection still runs rampant. And can I also suggest an improvement in terms of treatment here? For those who've been asked through NHS 111 to stay at home with symptoms of COVID-19, would it be possible to start sending out oxygen saturation monitors to the home to ensure that we don't find people presenting far too late with symptoms of COVID-19 when they get to hospital and they're beyond treatment at that point? And finally, innovation in testing, the subject of today's debate. Can we have an update from the Minister on the testing that has gone remarkably from 5 a day to 200,000 a day, but needs to find other innovations in terms of speed, but also methods. For example, like the pilot in Southampton with the saliva testing, which would enable our airline industry to get going again.
Munira Wilson.
Thank you, Madam